Hello, and welcome to the Things I Want My Daughters to Know podcast, the podcast redefining women's health one unfiltered conversation at a time. I'm your host, Jacqueline Rose, and every week I'll sit down with leading women's health experts and real women to share their lived experiences, bust health myths, challenge outdated and uninformed narratives, and explore what's really possible for women. We'll talk about periods, fertility, menopause, hormones, aging, and everything in between. This podcast is for every woman who ever felt confused, dismissed, or left out of the conversation about her own health. It is a space to celebrate women, break the silence, and open up conversations between mothers, daughters, sisters, and friends. Please hit the follow or subscribe button so you don't miss an episode and share this podcast with your daughters, family, and friends. Let's get on with the episode. Hello, everybody, and welcome to another episode of the Things I Want My Daughters to Know podcast. We are going to have a really great conversation today about my favorite topic, which is menopause and women's health. And I am very excited to welcome Colette to join me today for this conversation. Welcome. I'm so happy that you are with me. I know that we are going to talk about a lot of things, and I think that we are going to hopefully agree in a lot of ways. But as you know, this podcast is all about having challenging conversations, challenging the paradigms that are out there, challenging a lot of the myths that we believe around women's health. And I think, Colette, you're going to be a perfect guest to do this with me. So welcome. Tell us a little bit about who you are, what you do, and we'll get right into it.
Hi, everybody, and thanks so much, Jacqueline, for the opportunity to appear. I was very intrigued by the title of your podcast and definitely communicates what I believe should be a goal for those of us working in the menopause space today, in addition to a lot of other things that need to be addressed. I'm Colette Edwards, and I am the founder and chief medical officer of Positive Health. Positive Health is a one-stop digital destination that is holistic and is for women in all stages of the menopause journey. And we offer education, we offer resources, access to menopause trained clinicians and virtual physical therapists, as well as a diet assessment, music as medicine, and a host of other things with the idea that we will have what people need as their symptoms and their lives evolve over time, starting with perimenopause through postmenopause.
Amazing. You really are at the intersection of this sort of next phase of healthcare, sort of bringing it online to the digital age. So I definitely want to ask you all about that. But let's start off with sort of the most basic question, I guess, is how do you understand today's women's health situation, the menopause situation? I know you've been doing this for a very long time. You're not new in the game. And so how do you contextualize, I guess, where we are today versus where, we have been over the last, couple of decades? How do you see sort of today's situation of women's health and menopause?
So I believe, and it's abundantly clear, that the general area of women's health has been under-researched, it has been underfunded, and that it basically has been a situation where scientific research, medical research, as it relates to patients, guidelines, treatment protocols, has been based primarily on, at least in this country, white men and white men of a certain age, and then just extrapolated as if women were just a smaller version, which clearly we are not. We're much more than that, and it has ignored the impact of sex hormones in the picture for both men and women, much to the detriment of women. And once again, feeds into an assumption that basically we are a small replica of another being.
Yeah.
Although I believe that progress has definitely been made, if no more than you are seeing more about it, you're hearing more about it, more women are aware, are engaging, are forming communities. There
Yeah.
is now a push for more companies to provide access to menopause trained clinicians. There's
Yeah.
the start of additional training pathways for clinicians to learn about this stage of life because most do not receive that training, even if they
Yeah.
are trained in a GYN residency program. But I think that there is a long, 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 long way to go unless something transformational happens to push things to accelerate at an exponential rate. I
Yeah.
think there is a lot of room just for general education. I think there are lots of women who are experiencing symptoms, and some of them are common enough that the thought never crosses their mind because most people think of the symptomatic time of the journey as being in the 50s when it actually starts in the 40s.
Yep. Yep.
And that women, if they don't have hot flashes and night sweats
Yeah.
and mood volatility, if they don't have the stereotypical symptoms,
Yep. Yep.
then they think about it less. And it's
Yeah.
also a scenario where their practitioner may not be thinking about it
Yep.
either, particularly in that scenario. And it's common
Yeah.
enough symptoms that it can be attributed to others or dismissed altogether,
Yeah.
particularly given the typical age when it starts, when women have so much going on in terms of if they have children or they don't with their careers, their job,
Yeah.
aging parents, etc., that they aren't slowing down enough until they're stopped by their symptoms to even really think about it.
Yeah. And there are so many legitimate reasons, legitimate in inverted commas, reasons as to why they may be experiencing symptoms that an untrained or an uneducated practitioner, clinician, won't connect the dots in the right way. And will say, as you said, it's stress, it's work, it's this, it's that,
Right,
take an antidepressant, take some sleeping pills,
right,
you'll be fine.
right.
You use the phrase menopause journey, which is a phrase I use also. Explain to me why you use that language of menopause journey. I agree with you. I don't just use the word menopause. I think menopause journey is a much more appropriate phrase. What does that mean for you?
So for me, it is a life stage that for most women starts in their 40s, although there are, about 6% of the population where it can happen earlier, and then it extends through the rest of your life. The term menopause is applied broadly
Yes.
and without the thought process of there's the leading up to menopause, which is the perimenopause, and then
Yeah.
menopause, which is literally just that day that you've gone 365 consecutive days without having a period. And then it's the rest of your life. And that
Yeah.
rest of your life is 40% of your lifespan,
Yes.
which is
Yes.
spent in post menopause. So it's not a single point in time. It's not a single year in time. It really is a journey.
Yeah.
And different things happen at different times that can have significant impact, not just in the here and the now, but also in terms of your future health and health span. So it is an evolving picture over time. And so
Yeah.
that's why I call it a journey
Yeah. I
filled
agree
with
with you.
lots of different transitions.
Yeah, I agree with you 1,000%. And I think that nuance is what has done a disservice for women because clinicians have not been trained in general in what menopause is, we know traditionally, but more to the point that you're making is that the classic or common ways that menopause shows up is the only way that often it is being identified or diagnosed, which
Exactly.
I don't love the word diagnosed, but that all those perimenopause years are sort of made irrelevant because you're not yet in menopause or near menopause or menopausal in the colloquial way that it's being used, even by clinicians and practitioners. And so you could be 43 displaying really strong perimenopausal symptoms, but you're 43. So your healthcare provider is not going to be using the term menopause because you're not within that regular age bracket, without realizing, as you've said, this is a long journey that can start in your early 40s and goes way on, at different stages with different expressions and different characteristics for the rest of your life.
Exactly. And I
Yeah.
think that the other thing that can throw women off is they are, when they're perimenopausal, unless they are unable to have a baby for whatever reason,
Yeah.
they're still thinking, well, I can get pregnant, so I can't possibly be entangled in anything that would be tied to the word menopause or
Exactly.
menopausal. So
Exactly.
I just think that adds to the confusion, the
Yeah.
misunderstanding, and people being a little bit behind by the time they realize what's going on in terms of things that they could have been doing up to that point to prepare
Yeah.
for the journey.
Now, I know you see a bit of a relationship between the pregnancy experience and the menopause experience. And sort of adding on to that, the fact that now women are experiencing later pregnancies in terms of, they're a bit older in their late 30s, often early 40s, and that very often they can be pregnant or giving birth or have young toddlers at home at the same time that they are well in perimenopause because of this
Exactly.
later pregnancy experience that so many women are now choosing to do. So what do you see as the connections or the relationships between these two life stages?
So I, broadly speaking, look at, if you are female, there are kind of three big bursts of hormonal activity. And one is around the time and the years that you are first getting your pregnant. I mean, when you're first getting your period.
Period.
Then there's the time of pregnancy or infertility. And then there's the
Yeah.
menopausal journey. And what they
Yeah.
have in common is changes in their hormonal profile. And I see a thread definitely going through pregnancy to menopause that I think that a lot of women are not told about, and
Mm,
to their detriment in terms of symptoms, discomfort, being proactive. So, for example, if we already know that if you have gestational diabetes, you're much more likely to develop diabetes at some point in life. Well, when you
mm,
get to the menopause journey and your estrogen level is falling and then settles out at a low level, you're now at increased risk of diabetes just on that basis alone. So now you've
right.
taken risk number one and combined it with risk number two. Or if in the intervening years you have developed diabetes that may be in good control, the hormonal shifts that happen then may throw off the balance,
Yeah.
and you may need to change your regimen. And that's just one example. So
Yeah.
diabetes would be one, hypertension would be one, preeclampsia and what comes with that would be one,
Yeah.
pelvic floor issues would be another, where it's often the case that you will have pelvic floor issues if you have a vaginal delivery. Pelvic floor is an area that um, is something that lots of people don't know anything about, lots of people
Yep.
are not taught, lots of people are not educated about,
Yeah.
and therefore they aren't referred to a physical therapist who focuses on
Yeah.
pelvic floor. So then when things become lax after delivery and you start having incontinence, it may improve or go away for a period of time, but then pop up later
Yeah.
during the transition because of the hormonal shifts once again. And
Yeah.
so at the time when it first started, you haven't been put in a position to take action then that could have been taken, that could have meant no problems later or fewer
Later on.
problems later, or problems that could be more easily addressed. So that
Yeah.
is the through line that I see.
Okay. I totally hear that because I think part of what you're saying is your menopause experience doesn't just happen, in the year or the months or the day that you turn perimenopausal or menopausal. It's a build-up. It's everything that's gone on in your life
Right.
beforehand creates the
Exactly.
reality of what's happening once you go through perimenopause and hit menopause.
Right. And in traditional Chinese medicine, there is a belief, a philosophy that things that happen in your body remembers in some way. And
Right.
so
A
I would
hundred
say that
percent.
this is something similar, just like you see in people who have experienced trauma that then may manifest in different ways later in their lives. It's a body memory, it's a body um uh hard to, it's hard to describe, but it
Yeah.
really is exactly how you expressed it from the things that have gone before in your life in terms of your health and anything else that you have experienced. You are the sum of the parts that the things that you have lived, and this
Exactly.
isn't any different.
Yeah. And I think also for postmenopausal women who want to, age well, you can't turn around at 69 years of age and say, this is the type of woman I want to be in my 70s. It doesn't work like that. You've got to build it up the whole way. Which sort of leads me to my next question about how do you understand the menopause journey as this opportunity, a time for opportunities, an empowering time, rather than the narrative that we are really hearing of menopause equals symptoms? Because as you said, it's amazing that the menopause conversation is now exploding and there is so much more information. We still have a long, long way to go. But we are talking about perimenopause and menopause. We are talking about women's experiences. But part and a significant part of the conversation is around symptoms, is around how terrible and awful this is. But don't worry, because either you're going to take supplements or, the huge menopause products are on the market, or HRT and some type of pharmaceutical, some type of, money that you're going to spend is going to help you get through it. And I'd like to challenge that narrative, and I really would love to hear your thoughts about that because I sense that you don't agree with that approach. So, how do you understand menopause journey in sort of as a woman's lived experience?
So I see it having multiple components. And one is indeed about the symptoms that people experience, both physical and mental. It
Yeah,
is about the mindset that a person has about this stage of their life, which
yeah,
can actually, in many people, impact how they experience those symptoms and how severe they are. And a time where hormonal changes are having implications for the risk
yeah,
of both physical and mental health chronic conditions. So, for hypertension, stroke, heart disease, osteoporosis, high cholesterol, metabolic syndrome, as well as anxiety and depression. And so, if you've been tooling along and not having had a problem in any of those areas in the past, then your risk increases by virtue of the hormonal transition. If you have had any of those in the past, that may mean that a new episode may be triggered, or a condition that has been well managed now needs some tweaking. I think that it is an opportunity from the standpoint that this is a time where women can take control of their health and their well being, where they can step into their power, where they can focus on themselves, And we'll get into how easy that is because it's definitely not easy.
It's not easy. Yes.
But they can
It's nice in
focus on
theory.
themselves and and be armed with this companion piece, shall we say, to the symptoms themselves, because there's much, much, much more going on than is typically talked about. And so, if a person has been sedentary, if a person has been living on junk food because they're so busy, if a person is not getting enough sleep, if they haven't learned coping mechanisms for stress,
Yep.
then
Yep.
this is a time where they can make changes that could possibly positively impact their symptoms in terms of potentially not getting certain symptoms, or they are not as bad or as frequent, but also positively impact that risk of those other conditions or mitigate the impact on pre-existing conditions. I also view it as a time where women can really prepare for the rest of their lives. Now, we aren't looking at a 40-year plan, but for several years out and for a time of reflection without having to have a midlife crisis, but a
Yeah.
time of reflection of I've gotten to this point is, and my life will change just by virtue of gotten to this point, and now I'm, age marches on. How do I want to spend the rest of my life, and what things do I need to be thinking about to make that be possible? And taking action about your health and well-being and extending your health span obviously will make a difference as to what it is you're actually able to do and to what extent. So
Okay.
that's why I view it as an opportunity. Now, sometimes I also view women, particularly if they have severe symptoms, as being very, very activated already to take action, right? So it's easy to sit on the couch. I know this, and say you really should get up and go do some exercises and have a whole conversation with yourself about you should get up. And in the time that you're having the conversation, you could have done it already. But it's different when you are living with something on a daily basis that's being very disruptive. You're activated to do something because you need that relief. And I think that
Yeah.
that activation can be generalized beyond a particular symptom, but looked at more holistically in terms of the things that we know are foundational that do make a huge difference in how well we live our lives and how much we are able to do and how much we are able to enjoy the time that we have.
So I love what you say. I agree with everything. I want to just challenge you on one thing that you said at the beginning because I want to understand it a little bit better.
Okay.
Um, you've said that the hormonal fluctuations of this stage of life can exacerbate or can sometimes lead to a lot of these other things, of what we may call aging diseases like metabolic health, increased inflammation, thyroid issues, diabetes, all sort of, you gave quite a long
Right.
list of potential things. I want to clarify here. Does that mean that menopause is a trigger for these aging diseases? Does that mean that hormonal fluctuations are a trigger for ill health as we age? Um, yeah,
So the way that I look at it is we all start from a certain baseline that is based on our past medical history, that's based
yeah,
on our family history, that's
yeah,
based to exposures that we may have, so that we start off with a baseline level of risk for various conditions.
yeah, yeah,
And then there are things that are contributory. So let's say that there is a family history of diabetes. Well, you're more likely to develop diabetes yourself. So that's a contributory factor. But how you eat is a contributory factor. Physical activity is a contributory
yeah,
factor. How
yeah,
stressed you are, how much sleep you get can all play into, do you drift into pre-diabetes, take action, and then dodge
Right.
diabetes? Or despite your best efforts, do you still develop diabetes because the genetic pull is so strong?
Yeah.
Then the hormonal shifts happen, and that becomes an additional risk factor to contribute to the likelihood or impact your ability to manage or mitigate the risk of complications. So that's
Right.
what I mean when I say that.
Okay. And you've
As
obviously given
opposed
that
to you're
nice.
just sitting along and as a clean slate, and then you get menopause. And that is the only thing that is the reason that you
Right.
may develop these conditions.
Right. Yeah. That I think that's the important piece. It's not that menopause just comes in a vacuum and all of a sudden now that's the trigger. It comes as part of your whole health story and all the
Exactly.
contributing factors that may be playing a role in your particular situation.
Which is why it's important for the research and the funding to take place to
Yeah.
account for these things when you're looking at women's health, either something that happens only in the case of women or predominantly in women or manifests differently in women.
Yeah. Yeah.
It's not a minor point, even when it comes to something like medication. And in a world where there's lots of people on lots of medication, to
Yeah.
not study or even know what we do already know about differences. So, certain antidepressants being more effective with men versus women, and vice versa. These are not
Yeah.
minor points when you're trying to address a problem.
Yeah. So this leads me straight on very nicely to a question that I hope you don't think I'm putting you on the spot, but the hormone replacement therapy question. So you have presented a really integrative approach, a holistic approach that I absolutely follow, in that it's not enough just to sit and you know hope that you're going to live a healthy, nice long life. You need to be looking at your stress. You need to be looking at what you eat. You need to be looking at your sleep. You need to be looking at your exercise and movement. You need to be looking at, for me, it's also, connection and community and all these other things. Like there are lots of elements that contribute to being proactive in your healthcare. But at the same time, as you've said, our hormones are fluctuating. And as we enter into postmenopause, they reach a new level. And as you said, 40% of our lives we potentially are going to spend in postmenopause. So, what role, if any, and how do you see this whole conversation of HRT or MT, menopause therapy? How do you see it playing a role in this conversation? What's your sort of take on it all?
Well, I'm going to take a couple of step backs, and there are some things that for me and for positive health are just very foundational philosophies and beliefs that are manifest in the programming itself, the information that is made available. And one of those is that I believe that women should be made aware of all of their options.
Yes.
And I believe that you have to look at the person before you
Yes.
and what is going to work for them based
Yeah.
on their personal medical history, their family history, their
Yeah.
lifestyle, their education level, their income is going to vary for someone else. Each journey is unique. And to me, that's just a basic principle of taking
Yeah.
care of patients. Yes, you have to look at populations as a group, but then it still comes down to the person before you.
Yeah.
I think
Yeah.
that hormone therapy is fantastic for many women and it can change their lives.
Yeah.
But It's not a panacea. It's not a source of world peace, as sometime when you listen to people who are very evangelistic about it, you would be led
Yeah.
to believe.
Yeah.
It is not effective for every symptom that a person is going to have.
Yeah.
There are people who may not be able to use it. There may be people who don't want to use it for whatever reason. And there's also a lack of understanding in terms of, even if you just look at MHT itself, the different formulations and how
Yeah.
it doesn't have to be systemic. It could be something that is just a vaginal cream
Yeah.
because that's the main symptom that you have.
Yeah.
There are also people who use it and have very bad side effects.
Yeah.
And I think there's not enough of a discussion of birth control pills for use for some of these symptoms, because
Interesting.
there are people who can be managed with those dosages versus
Mm.
the larger dosages that would be typically given when you're talking menopausal hormone therapy levels. But
Yeah.
women need to know that there are medications that address hot flashes that are
Yeah.
not hormonal. They need
Yeah.
to know acupuncture in some people can help with hot flashes. They
Yeah.
need to know that their lifestyle makes a difference.
Yeah.
They need to know that herbal medicine works for some people. They
Yeah.
need to know that physical therapy, when you have, muscle aches and pains from menopausal, the musculoskeletal syndrome of menopause, is part of the picture, and that there's not going to be one magic wand that's
Yeah.
going to take care of everything, unless the only issue that you have is, for example, hot flashes, and you want hormone therapy, it works for you, and you don't have any issues with it and
Yeah.
no contraindications to taking it.
Yeah.
I
Yeah.
personally believe that this is a time of exploration and tweaking and finding the combination that works for you. And it may work okay this year, but things change. What worked
Yes.
before may not work in the future, and vice
Yes.
versa. And so you
Yes.
really have to be listening and paying attention to your body and staying up on what is available. Now, what I will also say is that the medications that get approved for certain indications get approved because they have been, randomized controlled trials, peer reviewed.
Yeah.
We can't possibly, for the menopause journey or anything else, do that for everything. There's
Yeah.
not enough money. There aren't enough people. There's not enough
Yeah.
years to do that
Yeah.
for everything. So sometimes you then have to go by reasonable observation of patterns in
Yeah.
numbers of people, or things that are noticed as side effects, if you will, from medications that were developed for another reason and they're used off label.
Right. Right.
And therefore, say, let's take the case of acupuncture. There actually is some data there, but there will be people who will tell patients, we don't have we don't have enough studies for that.
Yes. Yes.
So, okay, you may not have as many studies on that as you might have on, XYZ medication, or name a
Yeah.
thing. But you've also got thousands of years with billions of people
Yeah.
who acupuncture has worked for, and it
Yeah.
can't all be placebo.
Yeah.
And so to reject things and discourage them because you don't have a
Yeah.
published literature in droves, I think is not the best way to look at this. And this is, in my
Yeah.
mind, not specific to menopause. I'm not saying go out there and be, be a cowboy and just be throwing stuff around. That's definitely not what I'm saying. But by the same token, particularly if it is something that is not interventional.
Yeah.
So let's say something like guided imagery. It may work for you, it might not work for you. It has been
Yeah.
shown to help some people with hot flashes, shown to help with mood, shown to help with sleep.
Yeah.
So the likelihood of something horrible happening as a result of using guided imagery is extremely low. The
Yeah.
possibility exists it will help you, and you haven't had a procedure, or you haven't had something put into your body.
Yeah.
So other than the cost, which is not a non-issue,
Yeah.
what is the damage or
What are
the
the
risk
risks? Yeah.
done to try it? So that's how I look at it. And I think that it is really important for when a person is having a conversation that they themselves ask, what are my other options? What would you recommend for a
Yeah.
family member? What would you take yourself?
Yeah.
Because there are people and there are ways to have conversations with patients where you get steered in one direction or another
Yeah.
potentially. And
Yeah.
they're clearly, I believe, a group of people who I think they're doing it with the best of intention,
Yeah.
but they have become evangelists when it comes to hormone therapy, and they're trying to counterbalance the decades that were lost
Yes.
because
Yes.
of the Women's Health
Yeah.
Initiative,
Yeah. Yeah.
where
Yeah.
it's
Yeah.
hormone therapy is going to kill you. And I don't
Yeah.
want us to be in a situation where we go from it's going to kill you to it's going to cure everything.
Yeah, and every woman has to take it. I
Because,
agree with you. The pendulum has swung too
right,
far to
yeah,
compensate
for a
what
lot of
happens.
for some people it is, and it's also something that women hear a lot about and have heard a lot
Yeah.
about. So it's kind
Yeah.
of reflexive. If you aren't being
Yeah.
told and you aren't being shown and you don't know where to go to look for other things that are
Yeah.
available, it's normal that you would ask about it
And
and want it.
and also clinicians today, not only are they not menopause informed, unfortunately, many of our, most women are being treated within the conventional Western medical healthcare system. And even if you're going to a doctor that is menopause informed, they are only offering you HRT as a treatment option. They're not going to offer you a holistic approach. They are not going to send you to it for acupuncture or for Chinese, to a naturopathic herbalist, or they're not going to tell you, you've got it. They may talk now a little bit more about stress management, but their only way to know how to treat you is to offer you some type of hormonal therapy. There are very few doctors or practitioners within the conventional Western medicine system are going to even know to refer you on to other practitioners
Well,
that can
and
support
and
you.
I agree they're going to be, I think that you'll find people who are going to poo-poo anything that is not Western. I think that there are going to be a few people who actually know about these other modalities. And then, the hope would be that as more people ask about it, more clinicians would know about it and read
Yeah.
about it and educate themselves, or at least be neutral
Yeah.
and not judgmental without having a knowledge base of whether this is actually going to be helpful or if it actually works.
Yeah.
Because you have
Although
people who
we,
know
sorry to
nothing
interrupt you,
about.
but we do go back though to that point that you raised about the fact that there is not enough evidence to support these alternative treatment options, and doctors very much rely on the research and the evidence. And as you said, there's no money in guided imagery. There's not enough research done in how lifestyle changes really impact how we experience our health. There's so much observational studies and so much anecdotal information out there, but because it's not researched in that medical way that they like to look at it, and because it's not, that evidence-based studies, they don't take it seriously.
Well, and I think that that is true of many people. I think there are more and more people who are more neutral and more people who are becoming interested in at least learning more. But,
Okay.
I just remember having read several different articles where when you actually look at the data about the things that are done now for a host of different conditions, where there is not a really robust base of randomized control trial, peer reviewed, published. And there's a lot of that, but yet we are still doing things and using them in protocols, and they have become the way that things are done. Because once again, you can't possibly study
of course,
every single thing to the nth degree.
Yeah.
And when we are sitting in a scenario where the research that is being done isn't necessarily even taking sex into account, it is underrepresented when it comes to race and ethnicity. So, I mean, you see it as recently as during COVID, where, it was known that in certain circumstances, women were at much greater risk for COVID. But yet the studies that were being done in the moment, when the requirement for NIH funding is that you have sex taken into account, was still not happening. We're in the 2000s, right? 2020 was the start of the pandemic. So that just kind of puts into perspective how far we still have to go. It also puts into perspective, I think, some of the changes that need to happen in medical, nursing, pharmacy training, and internship, residency, fellowship programs. In this country, 69% of GYN residency programs don't have a designated menopause curriculum. So, it's not there for internal medicine, maybe a little bit in family practice, but the vast majority of clinicians, perhaps even your GYN, doesn't have a full understanding. Or even is on top of the latest menopause guidelines. So there's nothing easy about it. It's complicated, it's complex. And but I think that what you really need you are lucky if you have someone who is well trained, who recognizes what they don't know, that is not judgmental of what they don't know anything about, and is a lifelong learner and is looking at you as an individual. That ultimately is the answer.
I want to ask you brought up. Carry on.
Go ahead. Sorry. No, I was just going to say, because you want to be in a position where it truly is an informed decision on your part, right? Because you want guidance, but at the end of the day, you're the person with the symptom, you're the person with the problem, you're the person who's going to live with the consequences, but you need to be armed with the information in a way that is not judgmental, and assumptions are not made, and therefore options not offered to you.
So I love all of this that you're saying, but I want to touch on a point you brought up. You brought it up in connection to the pandemic and the total lack of understanding of how it showed up for different genders and different communities. How are you seeing that playing out with the menopause conversation, about how it's being presented and how it is, in my mind, really not being representative of different ethnic groups, different, women of color, different geographical locations, different cultures? the LGBT community. I can only tell you what I see in the UK. And I see in the UK, which is one of the leaders in one thing that I think we can be proud of in the UK is that it really was one of the pioneers of opening up the whole menopause conversation. But the problem I see with it is presenting it as a white, middle class, heterosexual female experience. And it is somehow seems to ignore all the nuances that are involved in the fact that every single woman, regardless of her ethnic, socioeconomic, cultural background, is going to experience menopause. So, how do you see that playing out? What's your sort of take on that?
Well, and kudos to the UK because you all have definitely displayed leadership. I mean, there are very good reasons why people got pushed to do that, but however they got there, I'm glad that they did. Um, I so I think that this is just another reflection of many things, and I'll just focus on one. So when you look at the research that has been done, just as in writ large, the research for the most part for most conditions has been focused on men, extrapolated to women. When you look at the research when it comes to women's health, it's focused on white women and extrapolated to other groups. And there's no requirement that there be a representation, like you stated, when the data collection is done and people are making recommendations or expressing their findings. So, I mean, when you look at the different things that come into play in terms of the experience that a person has. So, even to your point geographically, some data shows that if you live in the South in the US, then you're going to have more symptoms.
Hmm.
If you are Black or Hispanic, you're more likely to have severe hot flashes that last over a long period of time if they go untreated. Right. And that is bad enough in and of itself from the standpoint of the suffering, because it's the hot flashes, it's the night sweats, and as a result, it's the lack of sleep, it's the fatigue, the brain fog, etc. But within that increased risk tied to hormonal changes, hot flashes then become a compounding risk. If they are severe, long lasting, untreated, to the risk of heart disease and dementia. That's not a minor point. When it comes to, if you look at race, you will see differences within a given race between ethnicities in terms of which ones are more predominant when they actually have menopause onset. So it's at that level. If you have insufficient resources when it comes to money and healthcare access, that obviously makes a big difference in terms of the access you have. If you are someone who has immigrated, then and when I say, let's say immigrate into the US, because typically what you see when someone immigrates to the US, their health does not get better because their lifestyle is not good. Right. So you see people coming from countries where the risk of colon cancer is very low because they have physical activity, they have a high fiber diet, et cetera, et cetera, et cetera. They come here, ultra processed food, sedentary lifestyle. And it blossoms. Same thing when, studies for Japanese women who come to the US and their breast cancer rates. So there's so many different contributory factors that, and then just within a given person, their own personal and family history makes it unique. So you can see the different variations. Then you're also looking at, for example, the LGBTQ plus community, where now, in addition to finding someone who is trained with regard to menopause, they also need the combination of someone who is sensitive to and has expertise in the types of conditions that are more common within that group that will
Yeah.
then play into this whole story of the increased risk of chronic condition.
Yeah.
So it's complicated, and
Yeah.
people need to be cognizant of that. Patients need to be cognizant of that because I think that it helps people not feel like they are alone. It it helps crystallize their approach, their plan, asking questions, advocating
Yeah.
for themselves. Another example I will give is that, if you look at large studies, and large studies are not so large, but larger studies of Black women, they tend to be less likely to use hormone therapy for a variety of reasons.
Yeah.
But while at the same time, more likely to have severe, long lasting hot
Yeah.
flashes, for which
Yeah.
hormone therapy is the number one indication.
Yeah.
And they are less likely, even under those circumstances, to be offered menopause therapy
Yeah.
because the assumption is, well, she's not going to be interested in it anyway.
Mm.
And then you can see differences for women who are in the military, for example.
Yes.
So,
Fascinating.
but when you look at, the big groups, if you want to look at it more at a population level, women of color, LGBTQ plus community is a lots of differences that are that have not been studied sufficiently. When
Yeah.
you look at the menopause literature, you see the most with white women. If you see studies that have some degree of diversity after white women, then it's Black women, then it's Hispanic women, then it's Asian women. And then when you get
Mm.
to Native um, and NHPI, it just is a precipice that drops
Yeah.
off. The
Yeah.
other thing that gets lost, to your point about the culture, there are societies with cultures, there are countries that look at this time of life not as a negative, not even as a neutral,
Yes.
but a positive, where
Yes.
the
Yes.
stature increases as a person gets older.
Yeah.
Old age is
Yeah.
not a mortal sin, and menopause is not necessarily inextricably intertwined with getting older like it is
Older.
in this country.
Yeah. Yeah.
And the menopause journey isn't looked at as this terrible
Yeah.
time either. Some women
Yeah.
feel liberated
Yeah.
and their stature increases in their community.
Yeah.
So it's easy to
There,
get a
there,
very
there is
slant.
also in that cultural, sorry to interrupt you, in that cultural piece, I know that the Indian community in the UK, there's another cultural thing going on here, which is exactly the like sort of the reverse, where they don't talk about women's issues. They don't talk about periods. They don't talk about menstruation. It's sort of like it's very much a private, closed topic. And therefore, they're never going to talk about menopause. They would never think about going to their doctor to ask for help in symptom management because women's health issues in the Indian community is very much hush hush. It's very much a private issue. It's very much not talked about. So the cultural piece plays a role in lots of different ways.
Oh, absolutely. In terms of the belief system, what the approach is going to be, how much, what kind of context you put it in. So, something else that I will mention where you will see that in many ways, Black women suffer more symptoms that are more severe. But when you kind of look at the mindset about it, it is not as negative one as you might expect
Yeah.
in proportion to what they are experiencing,
Yeah.
because many are contending with so many challenges
Yeah.
in
Yeah.
like the
Yeah.
rest of their life
Their life.
in
Yeah.
terms
Yeah.
of microaggression, not getting an opportunity,
Yeah.
on and
Holding
on
down
and
two
on,
jobs. Yeah.
so that there is, and that's not the story for everybody,
Yeah.
but where you prioritize that and how much of a big deal it is going to be in comparison to other things,
Yeah.
obviously, as well as your outlook
Yeah.
on life. And I think that is why it is so important for this information to be discovered, number one, and then shared and educate people about without making broad generalizations and assumptions
Yeah.
that just because, for example, you are an Indian woman, that you are not going to ever talk about it with anybody.
Right.
Or if you are a white woman, you're dying to be on hormone therapy, because
Right.
it's a
Right.
delicate balance. You know,
Yeah.
it's like, observe, these are the trends, but the
Yeah.
person sitting in front of you is not a trend. They are a
Yeah.
person with their own their own story, and you need to address them as such.
Yeah. Fascinating. I know we've been talking for such a long time. We've covered a lot of different topics. I just want to end with one question, because you really are placed at that intersection between the digital world and health. And I guess sort of, to sort of end our conversation on how you see this interaction between the digital space supporting women's health, and not to get too sort of deep into it, but the role of AI, or just the role that the digital space can serve in supporting women's health.
I think that technology, even simple technology, can be very helpful in terms of access, that might not otherwise be available. I think that technology can make it more practical for people to become educated, and educated in a way that sticks, and they develop self-advocacy skills just because of time
Right.
constraints within the system, and not really a role out there, um, for that component within the healthcare system. I think that AI has a role to play, but I think we have to be extraordinarily careful in terms of knowing what we don't know, and picking the things where it is going to be a value add, as opposed to something that creates more work, more stress,
Yeah.
or something that becomes a security breach issue,
Yeah.
or something that gives bad advice that could
Right.
literally be life threatening. I think
Yeah.
that all technology has a role, and
Yeah.
it definitely has potential for positive, but it has huge potential to go in the other direction.
Yeah.
And typically we see the balance is more towards the bad than the good. And in medicine, there's just not room for that kind of error, because lives literally are on the line. But I think it definitely has a role to play, and can be an extender, a turbocharger, um, a reinforcer, but not a replacement for your clinician, not a replacement for that relationship, not a replacement for humans connecting.
Yeah. Yeah.
Um,
Yeah. Yeah.
it just can't
I
be.
think I think that's a really important point. I think that there is a lot that it can do, and especially in terms of the role that an online space can play. But and I sort of see in a very sort of specific way that AI can allow us to access research and information and the observational studies and the that maybe a regular doctor can't access, that maybe we can have more access to information that exists, the research that does exist. But we've got to be, as you said, really, really careful in how we use it. And I think the way it's been used a lot by women is, how do I treat X symptom, put it into, an AI application, and that's what they base their treatment options on. So we've got to be very
Right.
careful
And,
how
and
we're
there's
using
just
it.
early, there was, I guess it's been 2 weeks ago, something that was published that I actually posted on LinkedIn, where it has found already
Yeah.
AI failing women. There was a
Yes.
study of AI chatbots applied to women's health, and a high percentage, I think it was around 60% of the time, in scenarios that were described, that would be urgent, the response did not indicate this is an urgent issue and you need to seek
Right.
help,
Right.
which
Right.
obviously does not end well.
Yeah.
And I think that it's important for people to become skilled at AI and know what it can and cannot do. And that
Yeah.
just because it's
Yeah.
on the internet, even if it's AI, doesn't mean that it is
Doesn't mean.
accurate.
Yeah. 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 Yeah.
And just doing something as simple as verify what you've told me and is what you're telling me really true. And
Yeah.
you'll be shocked. A lot of the time it'll say very nicely, I'm sorry, you're right to call me out on that because actually blah
Yes.
blah blah.
Yes. 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 100%. Okay, Colette, we have talked about so much, and I really love your approach. Your approach is, resonates so much with my approach and my work. And I'm so happy that you're sharing it, because it's always nice to know that I'm not working in my own little bubble, and that there are other
Right.
people who understand that we need to look at things from a slightly nuanced way. And, the things that you've shared here are really, really important for women to hear. I always end my conversations with my guests with the one question of, this podcast is called Things I Want My Daughters to Know. And I created a podcast that they would listen to the things that I wanted to share
Right.
with them. What are the things that you want your daughters to know, whether it's your, real daughters that you have, or figurative daughters, goddaughters, nieces, that next generation of women coming up? What is it that you want them to know?
That they have more power than they recognize,
Mm,
that they need to educate themselves, advocate for themselves, and demand the type of care and support they need and deserve. I
yeah,
personally believe that it is, the two generations that are kind of in the thick of things when it comes to the menopause journey right now, where there will be a shift because they're technologically savvy. They are much less accepting of do it just because I say so, or that's the way it's always done, or we don't have anything else. It's
yeah,
like, well, why not? You need to create something for me.
yeah,
And I think that, at a high level, at least with the people I come in contact with, and just women in general that you talk to are on the journey, it's really important to them that one of the things is that others in the here and now and in the generations that follow will not have to suffer through what they're suffering through, will not have to
exactly,
experience all the medical gaslighting, and
exactly.
that they will be having different conversations with
Yeah,
their children to better prepare them for this stage of life and view it more as this continuum that
right.
you really need to be preparing for when you're young,
Yeah,
to
yeah,
get the most out of all of it and to be in the best position to extend your health span and be able to do all the things you're capable of doing for as long as possible.
yeah. I couldn't agree with you more. That's the mission of this podcast, and you've hit the nail on the head with your with that thought. So I really, really appreciate you joining me. Um, let everyone know where they can find you, where they can reach you. Where are you hanging out online?
So people can go to the website, which is positivehealth.com, and positive is spelled Pausitive. And Positive Health is also on Instagram, Facebook,
Amazing.
LinkedIn, Pinterest.
Yeah.
But
And we'll have
positive
all those links in the
PAU,
show notes.
yeah,
Amazing.
PAUSITIVE health.
Amazing. Amazing. Well, thank you so much for joining me. It's been a wonderful conversation. As I said, I could talk to you for hours, because we agree and resonate so much on the
Right.
things that you're saying. And I like to bring people, I've got plenty of episodes with people who think slightly differently or are sharing a slightly different approach. But I think women need to know that there are practitioners and professionals and knowledgeable people out there who see things a little bit differently to maybe what is being posted and shared on social media by influencers or people with very loud voices. So I really appreciate you sharing your thoughts.
Thank
Thank
you
you
so
to
much for the
everyone.
opportunity.
Of course. Thank you, everyone, for listening. Reach out to Colette, click on her website, go find out what she's doing at Positivity Health. As
Positive?
always, positive health.
Yes.
Rate and review the episode. Click follow so you don't miss a new episode when it drops. Everyone who's listening, thank you so much for joining me today. Thank you to Colette. It's been really wonderful to have you with me. And I look forward to seeing you all on another episode of the Things I Want My Daughters to Know podcast.
Okay. Thanks so much for the invitation.